So this video is about tumor-like conditions, also known as pseudotumors. Let's begin. So what is the definition of pseudotumors? The definition is pathological lesions mimicking real neoplasms. So with this, basically there are sort of masses which mimic real neoplasms, and we need to differentiate between the two. So the diagnosis is very important of pseudotumors. So it's good to start this question by naming all the types of pseudotumors which exist. So that gives your examiner an idea that you know the main classification of pseudotumors. So what are the main types of pseudotumors? First of all, the biggest group of pseudotumors is cyst or pseudocyst, or the most common group. Then followed by deposition of pathological material, for example, gout, ganglion, or amyloid. Then there could be inflammatory pseudotumors, for example, tuberculoma. Will be one by one. Then hyperplasia, for example, nodular hyperplasia. And then lastly, there could be choristomas and hematomas, or choristias or hemarcias, which is abnormal development or disturbance in the growth of the tissue. So starting with the first group, cyst and pseudocyst. What is cyst exactly? Cyst is a fluid-filled cavity lined by an epithelium. And what is a pseudocyst? It is also a fluid-filled cavity, but it is not lined by an epithelium, but rather mostly by a fibrous tissue as a result of inflammation or any necrosis. Liquefactive necrosis of the brain and pancreas, which result in the formation of a pseudocyst and not a cyst. Yeah. And can cysts become precancerous or cancerous? Yes, of course they can. If they develop dysplasia or atypia, they become neoplastic and they can develop into a carcinoma. So cysts are not always a pseudotumor. Like I said in the beginning, any mass should be examined and diagnosed properly, whether it is a pseudotumor or it is a neoplasia for sure. And how to assess if a cyst is a neoplasia, benign, malignant, or non-neoplastic, innocent? We need to evaluate the epithelial lining. That is how we diagnose whether a cyst is innocent or not. Okay, so in each group, you need to give some examples so to your examiner, so he or she gets to know that you know what you're talking about. So what are some examples of cyst? Well, we can talk about parasitic cysts, for example, due to toxoplasmosis gondii in the brain. Then we can talk about retention cysts, Nabothian cysts in the cervix. We can talk about chocolate cysts of the ovaries due to endometriosis. Then we can talk about pseudocysts in the brain and pancreas due to liquefactive necrosis. So these are some very strong examples, which if you mention in the exam, it will make your answer strong. Okay, so well, an example of where a cyst is not simply a pseudotumor, cystic ovarian tumor is the best example for this kind of question or this type of idea, basically. So you can talk about this in your exam, that cyst is not always a pseudotumor, but sometimes can be a tumor, for example, in the case of cystic ovarian tumor. Okay, so the next type of pseudotumor is deposition of pathological material. Here we mainly talk about gout, amyloid, and ganglion. What is gout? Gout is deposition of uric crystals in your joint cavities. Amyloidosis, you must have had it in general pathology as your final exam question. Then we have ganglion, usually in the hands or also on the foot. What is ganglion? It is the deposition of myxoid jelly-like substance in your joint cavities or subcutaneously. So this is something which is the second type of pseudotumor. Okay, The third type of pseudotumors are inflammatory pseudotumors. Most commonly here we talk about tuberculoma due to tuberculosis. For example, in the brain, you can see here, or suture granuloma, uh, which is due to suture material being broken down by the immune system and the granuloma develops around it. Okay. Next is hyperplasia, tissue growth due to increased numbers of cells. Most common example is benign prostatic hyperplasia, as you can see here. That is this is a differential diagnosis with prostate carcinoma. Hence, this is a good example of pseudotumor as hyperplasia. Next, we have hamartoma and choristoma. Well, what is a hamartoma? Hamartoma is disorganized growth of a native tissue. For example, pulmonary hamartoma. That means that the pulmonary tissue grew as a disorganized tissue in its own native site, and now it forms like a mass, like a hamartoma. The second type is choristoma, which is growth of normal tissue but in an ectopic site. For example, pancreatic choristoma, which means pancreatic tissue grows in either stomach or liver. That is growth of normal tissue in an ectopic site. Okay. Some other types of pseudotumors, which are good to mention and are also mentioned in your lecture of pseudotumor. Well, leukoplakia. What is leukoplakia? Leukoplakia is simply a white patch. And here you can see, for example, it can be hyperplasia. The white patch can be hyperplasia, just hyperkeratosis, or it can also be carcinoma. So leukoplakia does not give you a definitive diagnosis, and it can be a pseudotumor, it can be a tumor. You need to diagnose it histologically. And you can also talk about hydatiform mole or molar pregnancy, which also mimics tumor. Hence, we can put it under the classification of pseudotumors. Okay, so now the question is, can pseudotumors be or become precancerosis? Well, yes, they can if they develop dysplasia, dysplastic features. They can definitely become precancerosis or cancer, and they can progress to cancer, for example. That's why histological diagnosis is very important. And what is the risk of pseudotumors? Basically, why do we care about pseudotumors in the first place? Because we do not want to overdiagnose and overtreat a certain mass, or we don't want to underdiagnose or undertreat a certain mass. So it's very important uh, to give a definitive diagnosis whether a certain mass is a pseudotumor or not, or it is a neoplasia, for example. So in clinical practice, once we observe a tumor, basically a mass, we must conduct histology and cytology. And if the pathologist concludes it to be non-neoplastic, it is a pseudotumor. And if we find dysplasia as precancerosis, and if further atypia and metastasis, then we can call it a malignant tumor. It all depends on histology and further staging if required. So that's about it.